Hi, I'm Michael Smith. At Berkeley College, we're committed to educating the public about the importance of higher education and its impact on our communities. That's why we're proud to support the important educational programming produced by the CAUCUS Educational Corporation and their partners in public television.
Funding for this edition of CAUCUS New Jersey has been provided by the New Jersey Education Association, Wells Fargo, QUALCARE Inc., a managed care company administering health plans that care about your health care, Berkeley College, the New Jersey Office of the Insurance Fraud Prosecutor. Insurance fraud costs New Jersey families $1,300 a year. Gary's Wine and Marketplace, creating an individual shopping experience for every guest. And by the Community Food Bank of New Jersey. Find out how you can help. Promotional support provided by New Jersey Family Magazine and njfamily.com. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.
Hi, I'm Steve Adubato. It is my honor and pleasure, for the first time, it's my honor to interview John Kastanis, who is the President and Chief Executive Officer of University Hospital based in Newark, New Jersey. John, do us a favor. The footprint of University is? Describe it.
It's part of the former UMDNJ, the University of Medicine and Dentistry of New Jersey, which was dissolved by a legislative act over 3 years ago. And subsequent to that dissolution, the academic programs, most of them that were part of UMDNJ, were given to Rutgers University. And from that, we now have the Rutgers health programs. And the hospital itself, which is still on the same campus, is still a major component of the New Jersey operating budget, the state of New Jersey. And we are a standalone University Hospital, strongly affiliated with Rutgers Health, fulfilling the academic missions of both the hospital and Rutgers Health. So that's the new footprint of University Hospital.
But you also serve people right in the heart of the city.
Yes, we do, and beyond. But we are a regional academic medical center, as most know. One of the stronger attributes of that campus is we're the only level 1 trauma center.
Explain to folks what that means.
Well, level 1 is the highest level, the highest skill of emergency services that are provided to those victims of mostly, car crashes and fatal shootings. It's the most severe type of emergent treatment that's available.
That's where you would go.
And that's where you would go. It's well known amongst all the municipalities, fire, police, all the emergency technicians that operate ambulances in the area, when we happen to run the 911 system in Newark. But that's where most want to go when there's a real serious traumatic injury.
John, of all there's so many interesting developments happening in the healthcare world, and one of the most fascinating that we've read about recently is the Rutgers Cancer Institute of New Jersey at University Hospital.
Yes.
Tell us what that is.
Well, we have a relationship now with a rather well-known cancer program. It's NCI designated as a comprehensive cancer center. So Rutgers, which has the Cancer Institute of New Jersey, for the most part, up until recently based in New Brunswick, has now brought that, that cachet, if you will, that branding, and all the expertise that comes with it to the Newark campus at University Hospital. And I might add, we're very proud of all the cancer programs that we have had to date at University Hospital. In fact, some of the specialties, be it head and neck surgery, orthopedics, we have some really top-notch specialists who treat cancer victims in those particular specialties. But bringing on an NCI designated comprehensive cancer center.
National Cancer
Exactly,
Institute.
The National Cancer Institute. To have them now partnering with us allows us to expand our services. It brings an opportunity for more research, grant funding. It allows us for more earlier detection of cancer and really more education, spreading that the information that really needs to get out into the community.
John, stay on this. It's so interesting. I'm born and raised in Newark, as you know. We've talked about
Yes.
that. We have some mutual experiences in Westchester County, where I used to live, and New Rochelle, and you know very well of your early career in healthcare.
Yes.
But I know Newark and Essex County very well. And looking at the numbers, why is it that a higher percentage, seemingly, if I'm wrong, or correct me, higher percentage of Essex County / Newark residents get diagnosed with cancer later in the process? Why is that?
I think it stems from what I said earlier. We just have not done a good job reaching out with more education and providing more preventative care. The later detections are an issue. I recall that there was a period of time between 2002 and 2006 where the New Jersey Cancer Registry pointed out that there was really a high incidence, something like over 3,700 new cases of cancer during that time span, and the deaths from that same time span were over 3,700. Now, more recently, we've noted that the overall incidence of cancer in our immediate catchment areas has come down, but we still have a lot of patients that are presenting with cancers in areas such as cervical cancer, prostate, breast, oral. These categories still, the incidences do run high. And we really have to do a better job reaching out. And with this new partnership, we feel we're going to have that supplemental support and expertise to help us out with that.
John, the term patient-centered care is talked about a lot. What does it mean?
There's a lot of definitions to it. It's a broad statement.
What's yours?
But being in the industry for as long as I have, it's more
a lot of jargon, huh?
Yeah. But really, the reality is we have to do a better job as an industry, not just at University Hospital, but I think all of our colleagues in healthcare really understand that value-based medicine is what we have to focus on. And when it comes to patient-centered care, we have to do a better job in focusing on the patient and all other aspects of who they are as individuals, their family, their ethnic backgrounds. It's not just the disease, but it's all about the individual patient and who they are all about, and really finding extra support for the care that they need.
But why would that help, particularly with a cancer patient?
Well, with cancer, it's just one of those diseases that we haven't looked at. We have so much research going into it. There's so many private and individual funding campaigns, but we still haven't gotten to the point where we can really find a totally efficacious treatment to beat it. But we're getting closer. Not that I'm a clinician or a physician, but and I don't want to digress too much, but with the breaking down of the human genome and all the research that's now focusing on DNA and the sources of cancer, we're getting really close.
But knowing the patient's history, knowing the patient's family, being more patient-centric does help in the treatment of the patient with
really
cancer.
It's really relevant. And the different components of a municipality, it's not just healthcare, there's housing, there's transportation, there's education.
There are healthcare issues?
Healthcare is always at the head of the table. When housing and transport and education, when they're all looking at their respective issues and what they're trying to do with their respective populations, it pertains to healthcare. We have situations where people in a lifetime are living in low housing projects full of lead. And that lead poisoning does lead to different forms of cancer. And that's a housing issue, but ultimately it becomes a healthcare issue. So there are a lot of social determinants that come into play, but it all leads to healthcare at some point. And unfortunately, a lot of it leads to cancer.
Final question. I've asked a lot of leaders who come in here, because I'm interested in leadership, wrote a book called Lessons in Leadership, and I want to ask you, I never expected this question. What's the number one lesson you've learned about leadership?
Leadership is something where I've been given titles, as you just announced my title earlier. Titles are just one thing, but it doesn't really win you respect and faith in who you are as a leader. You have to earn that. And that was my biggest lesson to date, that no matter how much experience I have, what I bring to my leadership role, now currently at University Hospital, you have to win the respect and the recognition of the people that you're leading.
Leadership is not a title.
Yes.
John, well said by John Kastanis, who is I'll say his title anyway, he's the president and CEO of University Hospital in Newark, and one of the underwriters and supporters of us at Public Broadcasting. Thank you so much, John. Appreciate it.
It's my pleasure.
We'll be right back right after this. Thank you, John.
To watch more Caucus New Jersey, find us online and follow us on social media.
One of the great things about this conference, this Kessler Foundation conference, Life After Stroke, is you get to meet some pretty special people. This gentleman on my left I've seen before, but he's joining us now. He is Howard Rossman, a Stroke Robotic Exoskeleton participant. Now, that's just a description of you, but this exoskeleton equipment, we were talking to Dr. Knowlton, who's actually right behind you, and she described it in detail, but you're wearing it.
Yeah.
Describe what it's like to be in it.
To be in it is wearing a body brace that is self-directing of my feet in a timed manner, because I have no movement in my left leg when I started using this. And up until this year, this device was not used for traumatic stroke victims. And so they started this year, and it gave me the incentive and motivation to see that I can use my left leg again, which I didn't know I could. And this has helped me.
Howard, you experienced a stroke when?
April 9th this year, 10 weeks ago, for Saturday.
What was your life like before that?
Very active, very full. The day of the stroke, I went to a Little League game to see my grandson play. We got out for dinner, and we were watching TV at night. I felt wobbly, fell asleep, and woke up in the middle of the night and fell to the floor and realized I was having a stroke. So I was working full-time as a substitute teacher, running a travel agency and living a full life.
This exoskeleton, and I've seen people walk in it before, but I've never really had the chance to talk to someone who's in it and moving. When you first got in it, describe that experience.
The experience was anxiety and apprehension, because I felt I may fall, but apparently not. They gave me the cane to wear, and there were two people on either side with their controls, and they had a backup with a wheelchair in case I were to fall backwards. So they gave me confidence, and I probably walked about 150 steps the first time I used it. And then I was trying to buy more time to get on it, because it's a very popular machine.
Yeah. Everyone wanted to be on it.
Yes, that is correct.
Or in it.
In it.
Yeah. And describe your ability now in the exoskeleton.
My ability now is better than it was 5 or 6 weeks ago when I last used it, because of the continued therapy I'm taking in a subacute facility, which has increased my motion of my left leg. So I have more mobility than I had before, so this is a little bit easier to use. But it is restraining, and you're apprehensive when you see it.
I met your wife and your daughter earlier this evening, and they're obviously proud of you and looking forward to hearing you tonight. Let me ask you this. What message do you have because there's 7 million people in this country dealing with stroke, what message would you have for them? Because you never expected it, you were totally active, and here you are now working hard to live your best life.
The advice I would have is that expect a long and slow recovery. That we played fire drill in my house for a period of time. What happens if I do have a stroke or a heart attack? A person of 75, of a certain weight and stature and blood diagnosis can be prone to it. I played fire drill with my doctor. What happens if? Where do I go? Where's the stroke center? So when it occurred, I was emotionally and medically prepared for this incident. I would recommend that when you get it, to go to find out where there are stroke centers nearby that can cater to you. I was very fortunate to go to Robert Wood Johnson very quickly, who had a stroke center. And when it came a choice of several acute care facilities, Kessler came up and was on the top of my list. because we had used this facility in 1976 for a family relative. So I have a great deal of confidence that I will get better.
We're at Kessler Foundation, Life After Stroke. This panel discussion, this forum is recently concluded. One of the people in the audience, David Knowlton, who knows more about healthcare than most folks in this nation, was part of it. By the way, let folks know exactly why you were here tonight.
Well, I actually chair the stroke committee for the National Quality Forum, doing stroke measures and coming up with new standards. Dr. Barrett was on that committee, and I've referred many patients to her. Yeah. Her work is just amazing.
Yeah, Dr. Barrett was one of the panelists who talked about this whole issue of, on your left side, this spatial
deficit, yeah.
Yeah, spatial, deficit, if you will. And so the goggles that she talked about that can make a difference. It's so important for people to know about the research going on and about how they can be helped, right, David? Well,
it's important for them to know and for them to communicate it. So doctors give up on patients too soon, as opposed to saying there's options. If you're leaning to one side, and the work that Dr. Barrett's got can get you back to center, you can feed yourself. You can sit up. It can affect your mobility. And there's hope for people in a little device that is probably cheaper than what you and I'll spend for dinner.
Those goggles?
Yeah.
So it's interesting. You did that work in stroke. It strikes me, because some of the questions were asked, like, what are the risk factors for stroke? Am I more inclined if I have family history? Can I stop it if I exercise, stop smoking, whatever? We're not as knowledgeable as we should be about stroke, are we?
True confessions, I had a stroke. I had a full right side stroke.
You did?
Driving home on the Thanksgiving Day, the Connecticut Turnpike, had a full stroke.
How long ago?
2007. No deficits, because I got people who cared for me that quickly, and people who were saying deficits were unacceptable. So I'm a passionate believer in it for obvious reasons. I was chuckling when people were talking about what can cause a stroke and so forth, and you don't know and everything. And the woman on the end up here said, you don't know. I didn't expect to have a stroke. I didn't expect to have a stroke. I was driving a car. And I had a very, very bad stroke. Yeah.
Well, thank you for being here tonight. Thank you for everything you do to help inform us about important healthcare issues. Thank you, David.
Yeah, thank you, Steve.
To see more CAUCUS New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
We welcome Candice Bland, who is a Spanish teacher at Hightstown High School. Good to see you.
Thank you. Thank you for having me.
You do an amazing thing. You take your students to Spain?
Yes.
Where in Spain?
To Granada, to the south of Spain, Andalusia.
Who are these students?
They are my students in levels Spanish 3, 4 honors, and AP or dual enrollment, who want to enrich their Spanish language skills and extend the school year, because it happens after the school year in the summertime. And I start promoting it come June for the following July, and they just start signing up. So it's been happening for about 6 years now.
It's a beautiful thing, and we're gonna, instead of just talking about it right now, Candice, we're gonna show a video from the Classroom Close-Up series produced by our friends at the New Jersey Education Association, Candice Bland, and her students going to Spain.
¿Alguien más puede decirme otra cosa interesante que te pasó en España?
My name is Candice Bland. I am a high school Spanish teacher here at Hightstown High School. During my graduate degree at University of Delaware, I won the fellowship to go to the University of Granada as a professor for a year. I really just remained friends with all of my colleagues in the University of Granada. And about 6 years into my teaching career, they started sending me emails like, Candice, why don't you bring some students over? And finally, in the year 2010, I decided to take them up on their offer. When we get to Granada, we pull up, to the plaza. All the families are standing there waiting. So they get off the bus, they have the pictures of the kids. They're like, oh, you're mine, you're mine, you're mine. And they go home, they get showered, they have their first dinner with their family, and then the next morning it's time to go to coursework.
Entonces, en español, ¿quién quiere decirme
La vida con la familia?
Sí, la cosa que me gusta más es la sobremesa. Y la sobremesa se trata de una conversación que se tiene después de la cena normalmente. Y se come la cena a las 10 de la noche. Y hasta la medianoche, están discutiendo cosas de todo, de la vida personal, de la política, de la vida contemporánea. Es muy interesante.
They were studying enriched classes, immersion classes in the morning, and in the afternoons doing cultural excursions.
It really is a life-changing experience, and for me that happened when I was 15 with a similar program. To have the opportunity to do this in high school, I mean, it opens up your eyes to a world that is just so amazing. I mean, traveling really broadens your perspective on life.
Matt, what was one of your favorite excursions that you went on?
It really opened my eyes because this is a whole nother culture, a whole nother way of expressing yourself, a whole nother art form, and I got to experience that firsthand.
I want them to be more of a global citizen. And I want them to understand the importance of being bilingual. It is so important for us, especially to speak Spanish, especially in New Jersey. We have a huge need for bilingual professionals in all walks of life.
Conocimiento.
Vale.
No pasa nada en Granada.
Hola, chicos.
Riquísima.
Muy bueno.
Extraña.
Vete a Granada.
Bonita.
Pásatelo bien.
Tapas. Muy divertida.
Es fantástico.
Muy chulo.
Global citizens. What do you mean?
I just find that a lot of times I meet students who do not have the impudence to leave New Jersey and don't want to see what's out there beyond their doorsteps. And I feel it's part of me as being an educator to want to make them lifelong learners, as giving them that travel bug. And if they're interested and trust me enough, I'll take them with me anywhere. Because it's a huge trust factor. And they have to want to be with me for 20 days. All of a sudden I go from having one child of my own biologically to having sometimes 35 students I've brought with me. And it's a lot. It's a huge responsibility, both for me and it's a huge risk for them. They don't know how they're going to react to a new culture or live with another family, shower in another bathroom, eat food that they're not ever used to eating or thought they would never ever try.
Right.
So I like to show them that they can and will survive and come back completely changed. And their view of life is just more worldly. And they're able to go out into the world. I feel like I'm prepping them to be an adult. Whether they're gonna go to college or go into some sort of trade, that they have the confidence in themselves and believe in themselves. That I traveled, I went on my own, I dealt with my own passport, I dealt with my own finances, I dealt with a language barrier.
That's
and
second
I survived.
language. I'm sorry for interrupting. Being bilingual, why does it mean so much?
Bilingual brains are beautiful brains. And they see double meaning in everything in life. And as that's one of the motivations for a lot of my lessons when I teach. So the idea that I can bring them abroad and show them how amazing and fulfilling it feels to be able to communicate to another person in their language, not just a language they understand. If you talk to a man, there's a quote by Nelson Mandela, if you talk to a man in a language that he understands, it goes to his head. If you talk to a man in a language that they speak, it goes to their heart. And I love that quote, and I like to see that happen with my students right in front of my eyes, not having to force them, like it would be a forced, non-organic situation in my classroom. And to see them use organic language, it's amazing, it's so fulfilling.
How much do you love what you do?
I am enamored by what I do, and it motivates me every day to go to work and show kids that speaking another language is assuming another trait in their personality, because you have to put on a show and know how to assume that character. not just speaking it in a linguistic fashion, but also a social fashion, and knowing the cultural cues. And I loved traveling to Spain. It changed my life. I did a very similar program, and I'm still best of friends with the people I lived with when I was there. And it makes me feel like I accept people more, you know?
You're changing young people's lives,
Yeah.
potentially for the rest of their lives. Candice Bland, who is a Spanish teacher at Hightstown High School. Thank you for joining us.
Thank
We
you so
appreciate
much for
it.
having me.
Well
I
done.
appreciate it.
The preceding program has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of CAUCUS New Jersey has been provided by the New Jersey Education Association, Wells Fargo,
QUALCARE Inc.,
Berkeley College,
the New Jersey Office of the Insurance Fraud Prosecutor,
Gary's Wine and Marketplace, and by the Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. CAUCUS New Jersey has been produced in partnership with TriStar Studios.
At Gary's Wine and Marketplace, planning parties is our business. Our associates can work with you to plan the details. We offer an assortment of wine, beer, spirits, cheeses, party platters, accessories, and more. 4 locations in New Jersey and at garyswine.com.